Today, let's see the models to screen anti-diabetic drugs for type 1 diabetes mellitus. So, what are the different ways in which we can produce animal models to screen type 1 diabetes mellitus? First method is chemical method. We can use various chemicals such as streptozotocin, alloxone, dialluric acid, and diethazone for inducing diabetes in animal models. In spontaneous animal models, we have different types such as non-obese diabetic mouse, bio-breeding rat, Lawrence Evans, Tokushima lean rat, New Zealand white rabbit, and Keishan dog. In miscellaneous models, we have viral-induced diabetes mellitus, antibody-induced diabetes mellitus, surgical method, growth hormone-induced method, and drug-induced method. So first coming to the chemical method, we have seen we can use two chemicals such as alloxone or streptozocin to induce diabetes. So when we give streptozotocin, we give it 60 mg per kg IV or 40 mg per kg intraperitoneally to adult Wistar rats, and we will evaluate the blood glucose level 2 to 5 days later. And if the blood glucose level reaches more than 200 to 300 mg per deciliter, then we confirm diabetes mellitus in these rats, and then we give the test drug and record the observations. Similarly, for alloxone, we give 100 to 175 mg per kg intraperitoneal or IV to adult Wistar rats and induce diabetes in them. So, how does streptozotocin causes diabetes mellitus? This streptozotocin causes free radical generation, produces oxidative stress, and causes beta cell reduction, causes insulin insufficiency, thereby producing chronic hyperglycemia. They also cause neuronal injury and neuroinflammation and affect the nerves supplying the pancreas. Thereby, they produce diabetes mellitus type 1 by causing destruction of islet cells of pancreas. Similarly, alloxone gets reduced to dialluric acid and they produce alloxone radical, they produce reactive oxygen species and which will destroy the beta cells of pancreas and produce type 1 diabetes. The next model is spontaneous model of diabetes mellitus type 1. The first one is NOD mouse or non-obese diabetic mouse. These are Swiss mice which are inbred and they belong to specific strain called JCL-ICR mouse. So when they are 12 weeks to 30 weeks, they spontaneously develop diabetes mellitus. So how does these mice produce diabetes mellitus? Because in these mice there is a genetic variation which causes CD4 CD8 B cells macrophages to infiltrate the islet cells of pancreas, and females develop faster onset of diabetes mellitus 60 to 80% than male mice. So here we can see there is humoral plus cellular sensitization against autoantigens. There is T cell infiltration of the various glands, one of them being pancreas, and it also causes islet cell destruction, producing diabetes mellitus. Biobreeding rat is another spontaneous animal model to study type 1 diabetes. In here, this biobreeding rat are Wistar rats from Canada, in which they have an autosomal recessive trait of developing autoimmune disorder in which the beta cells of islets of pancreas gets destructed. These biobreeding rat develop diabetes between 60 to 120 days of age. The genes involved in producing diabetes in these rats are found to be MHC2 and GIMAP5, and these rats have severe T cell lymphopenia. The miscellaneous methods of producing diabetes mellitus is antibody-induced diabetes mellitus. Here, bovine insulin dissolved in acidified water and an emulsion is made with Friends adjuvant. Two doses of 1 mg insulin subcutaneously is given to male guinea pigs weighing 300 to 400 gram monthly once. After two doses, these guinea pigs are sacrificed using cardiac puncture and their serum is obtained. 0.25 to 1 ml serum is injected to rats, and these rats there is endogenous neutralization of insulin by antibodies in the serum because there is destruction of beta islets cells of pancreas. There is no insulin and glucose values goes up to 300 mg percentage. The other miscellaneous model is virus induced diabetes. Here we do pre-treatment with cyclosporin A and then we inject EMC-D virus, encephalomyocarditis virus or Coxsackie B4 virus in adult male Swiss mice and they produce diabetes mellitus. So these viral infections produce pancreatitis, reduce B cell function. They also cause immune activation and produce cytokines and cause insulin resistance and thereby destruction of the pancreas islet cells. In miscellaneous methods, surgical method, there is pancreatectomy done. Around 70 to 90% of pancreas is removed in rats and mice and it produces diabetes mellitus. In repeated growth hormone administration method, growth hormone is administered to adult dog and cats repeatedly till there is loss of beta cells of pancreas producing diabetes mellitus. Thank you. The source of this lecture is Postgraduate Pharmacology by Saugata Sarkar et al.